Welcome to ABP Desam Health Conclave 2025.
So, ladies and gentlemen, the next session today, the topic stands the future of healthcare, how personalized medicine is changing the game. For which, let's put our hands together as I invite the moderator, Dr. Suravi Sharma Kumar, author and health systems management and administration, who works with NGOs to support preventive healthcare for underprivileged communities. Can we give Dr. Suravi Sharma Kumar a huge round of applause? Let's have her to the stage. Now comes the time where we invite our speaker. Put your hands together for Acharya, founder and CEO of Map My Genome, who's awarded as the Young Global Leader by the World Economic Forum in 2011. So let's put our hands together as we dive right into the next session, which is the future of healthcare and how personalized medicine is changing the game.
Hello, good morning everyone, distinguished guests, the whole auditorium full of medical students and the health professionals, and we are here today. I'm so glad to have this opportunity to invite you, to welcome you to this discussion with one of our experts in the field of personalized medicine. As it's a very futuristic topic, and our previous panels and previous discussions has also touched upon all the technical areas. It's also about DME sir and everyone, they were also talking about technology-integrated medical education, telemedicine, and all AI in healthcare. So it's already, the discussion has been about transforming healthcare in today's context, and the topic that we are going to discuss is even more futuristic. It is already in place, already a lot of work has been done in the area of precision medicine, but still yet it is not fully adopted in clinics, in real life clinics, and is more of a research topic so far, though there are certain areas where it has revolutionized treatment. Healthcare system, as you have understand, healthcare delivery has always been a one-size-fits-all approach. So this one-size-fits-all approach is now, it's time for it to change, and it is changing with the help of genomic studies, where a person's genomics, the genome mapping, and all the genetic details are mapped, and a report is formed where we will see a person's total genetic makeup, like predispositions to genetic disorders, to susceptibility to disease, even his lifestyle choices. Everything is detailed, is available to us nowadays with the help of genomic studies, and these reports help the clinician make the clinical decisions right and unique to that person. So it is not one size fits all anymore. It will be unique treatment for each individual. So like we have one fingerprint, unique fingerprint. Everyone has one fingerprint unique to that person. So it's a genetic imprint, which is very unique to that person. So the treatment will be customized and tailored according to that person. That is the promise of precision medicine. So today we have with us Anuradha Acharya ji, who is an industry leader in this field. And so we will be exploring the topic with her help, and try to understand what is in store for us in near future, or what is already achieved. So Anuji, you want to give a small introduction, or I should come to the questions directly?
Sure. No, first of all, thank you, Dr. Suravi, and thank you, ABP, for inviting me here. I think many of everybody is today has heard about DNA and RNA, has heard about things, right? And I think that's part of the excitement about personalized medicine that became a lot more popular during COVID, because pretty much everybody had to do a swab. Pretty much everybody got to understand about variants and things like that. But I think personalized medicine has a lot more capability to be able to help, especially doctors. And today, those of you who are in the medical field, I think will realize that when you graduate, you will be using this pretty much on a day-to-day basis. So it is important that you get more familiar with what we have in the personalized medicine space. And maybe we can talk a little bit more as we go along.
Yeah. So my questions will be, the first question will be very basic. It is about the capability of personalized medicine, because it's something new to the healthcare landscape of the country, maybe globally also. So we'd like to know if I get my genetic imprint, genetic mapping done, or anyone else gets it done, what is the capability we can expect? What is the benefit we can expect out of it? That's a very, very basic thing that is in our minds.
Surely. So I think when you think about what you are getting out of personalized medicine, or when you get a genome test done for anybody, you have to realize that you are basically taking any cell of your body. When you're getting the DNA, we then sequence it to be able to get the data from there. Now, in each of those cells of yours, you have about 3.2 billion base pairs. And when you start looking at the whole genome, that might be a lot of data that might be there today. So I think what you can get today from a genome testing, one could be, when somebody is planning a baby, you want to understand if you're likely to pass on a genetic disorder to a baby. That could be one, right? So you do a carrier screening before you plan a baby. So things like your thalassemia and other recessive disorders, whether those are going to be passed on. So that could be one. The second would be during pregnancy, for instance, you are doing a lot of genetic tests to be able to understand what's going on with the baby's future, right? So you do things like NIPT and others, which are non-invasive tests done today to understand if you're chromosomally and others, if the baby is all right. Now, let's say the baby comes out. You want to understand now whether you want to give them the best nutrition and the best fitness for them. So you can also understand for that particular baby whether certain types of nutritional deficiency is likely to be there in the baby or in the young child. You can also understand if you want to put them in football or any of the other games or cricket, whether they are likely to be a sprint athlete or a marathon runner. So there are things that are more interesting from a behavioral standpoint also. You can understand those, sleep and other things that are there. And then as you go along in your life, you also look at things where you can understand whether you have a risk for predisposition for a particular type of disease, which means that is this person likely to have a risk for type 2 diabetes, risk for a particular type of cancer or anything else. But you can also understand the other determinants of those diseases, right? So for instance, when you look at just cardiovascular diseases, you are also trying to understand if you're likely to have high blood pressure, you're likely to have, you're certainly going to respond to a particular medication like a clopidogrel and others. So I think it is a lot of those different aspects of what you can get out of a genome, and look at a variety of different medicines that you might respond. So do you give them the same dosage? Do you change the medicine and so on? So those would be another set of things that you can look at for personalized medicine. But there are also other fun things like, can you understand where you came from? What are your roots? That might not necessarily come under the realm of healthcare. But I think genomics is an exciting area because you are not just trying to help people treat a particular disease, but you can also now start to understand how do you look at data that comes from your genome and also from microbiome and other things to be able to say, how do you live longer? How do you not age as much? So I think the whole field of longevity and others is also taking shape with these technologies that we have.
So it's not only just disease prevention and treatment, it's much more that we can expect from precision medicine or personalized medicine. At the same time, we would like to know for our knowledge, what is the global best standards achieved so far by any clinician, any oncologist, with the help of personalized medicine. So be it in India or abroad, so there are a couple of conditions that has shown a lot of success in treatment with help of personalized medicine. And those are a few, as I know, is like cystic fibrosis and some breast cancers and lung cancers. So we would just like to know a few examples from you where a clinician has really made a real life impact using inputs, reports from genomic studies.
So I think if you take India, for example, I think the places where we are seeing the most clear-cut use cases are in the case where you're looking at NIPT, which is when you're planning a baby, that is one, or carrier screening, or diagnosis of rare disorders, right? These are things that have already started taking place. The other thing where we started about 12, 13 years ago was to say that can you understand the predisposition or prevention of a particular disease? Because I think as we go forward, we will start to see that it is not just your specific disease that you are looking at from a treatment with a medicine, but you will also start looking at environment, you'll start looking at food, you'll start looking at fitness, because ultimately those will be what will create the right kind of value for the end user. So I think that's what is there. In the US and many other countries, we are seeing a lot of advancements in the case of cancer. Even in India, I think we are now seeing that a lot of cancer treatments, whether it's immunotherapy or otherwise, or even just chemotherapy, you can look at whether a particular medicine has the right, whether an individual has the right kind of genetic makeup. Based on that, the right medicine is given. And I think that is transforming the way you are looking at the whole aspect of medicine. How do you treat a patient, right? And you don't just treat this, you don't just give the same thing to everybody. Just like we all don't eat the same food, we all don't wear the same clothes. I think each one of us is so unique because our DNA code is unique. And therefore, we have to realize that when we are treating patients, that every individual is different. And therefore, that personalization, whether it's pharmacogenomics, which have also now started, we are seeing a lot of that happening for many specialties. But I would say that the largest, where we have seen the most, at least in India, has been psychiatry, cardiology, diabetes, and cancer. Those would be the areas that we've seen, and neurology, of course.
Because every person is unique, and every disease manifestation in different person will be different. It's unique. There's a difference between certain disease, how it manifests in one person than the other person, and how the disease will progress in one person will also vary significantly than another person. Even the treatment response can also change. It can also vary significantly. So all these factors that we can, the clinician or oncologist can take in consideration with the help of genomic studies, and that can tailor make or customize treatment for that particular patient, which definitely is going to be much more potent than a regular one-size-fits-all treatment. So as everyone will agree that the genetic studies have become the words that are like genome sequencing, genome surveillance, all these genetics-related words became very commonplace at the time of COVID. COVID is the time when we first, probably many of us, because I'm a doctor, it's a different case, but otherwise, a common household, for the first time, they got exposed to these words, genomic surveillance, and there's the government of India forming a consortium of genome surveillance consortium, where 10 laboratories were in one chain. So all these things were everywhere in the newspaper. It's the first time, probably there's a good exposure of people, the common people, to genetic advancements that are going on. And there has been decades and decades of studies by people like Anuji, and there are a whole lot of genetic teams world around who are doing research for decades, and now it is at a mature stage. So it is the public health, during the public health emergency is when this came to the fore. So we came to know more about genetic studies only at the time of public health emergency. So we'd like to know from Anuji, like how in public health it can contribute. We know it can control disease outbreak, viral transmission, but is there more to it in the preventive side and also in breaking chain of pandemics and endemics kind of thing? We'd like to, what more can we expect in the public health area?
Certainly. I think for public health, I think there is a lot that can be done. And while you can also look at genetic makeups of your individual constituents as individual people, that would be a very helpful thing from an overall population base as well. But there are other things that can be done on a public health basis. And I think maybe some of you might remember that there were some of these wastewater sequencing that were done as surveillance methods. Similarly, I think if we start sequencing environmental, like your air quality, your microbes in the air, you start to look at the soil and others, I think all of those ultimately have an effect on human health. So there is a huge effect of saying, can we look at not just pathogen sequencing or a host sequencing, which is human beings, but we can also start looking at all the other environmental effects that can come on health, your food effects on health. That's the kind of place where I see the most value in public health. So sequencing for microbes in the air, in the water, in sewage, and everywhere else. That would really help in building a much more stronger surveillance method for the state and the country.
What about us? We have been hearing a lot about this newborn genetic testing, which is made mandatory in different countries. In India also it is done in the private sector, but it's not yet mandatory from government side. So that is also
absolutely. I think you hit upon something that is very essential. And while there are a few Nidan Kendras in India that do the testing for newborns, we can do before newborns as well, right? I mean, ideally, I think we could just do the screening of the couple before they plan a baby, because that's where you can actually prevent a lot of diseases being passed on. So when you look at somebody who is a carrier for things like thalassemia or cystic fibrosis or others, I think if their partner also has that same recessive gene, then there is a problem of passing it on to the child, a risk, and they need to be counseled on that. So I think the 1/4 risk, or if it's an autosomal dominant, then 50% risk, that's essential to be able to communicate to the public that this is something that can be done. And the Nidan Kendras currently are still few and far away, and I think we need to make that as something that is mandatory for everyone. I think we'll start seeing much lesser number of cases of any of these diseases which are potentially preventable for all of us.
So today we have a good number of medical students here. So would you like to just let us know in very simple language, in layman's language, something about genome sequencing? Maybe all our budding doctors will want to know. So it's just basic of genome sequencing, then things like gene therapy or target therapies. So maybe in very layman's language, just for understanding, very basic understanding. And also we have been hearing a lot about DNA sequencing. Is there a RNA is involved, sequencing is done? So just maybe 2-3 lines you can would like to have.
So I think maybe the simplest way to think about sequencing is like a big recipe book, right? Just think about like this really big volume of 23 chapters of a recipe book with lots of information that is there, with lots of details, right? That's your whole genome. And that would be about 3.2 billion base pairs. So in each cell of your body, when we extract the DNA, that's amount of data that you are getting. Typically, when we are doing like a whole genome sequencing, which would be almost 90 gigabytes of data, there is a huge amount of data that you're gathering, and you think about it as this recipe book with all these 23 chapters that are there, right? Which are basically your chromosomes, if you think about it in that form. And instead of A, B, C, D, E, F, G, H, you can think about the letters that we have as only A, C, T, and G. Those are the 4 letters that we are using. Now, one way is to do the whole genome sequencing, which would mean that you have a lot of data, which would mean a lot of cost, which would mean a lot of analysis. The second, which is the most commonly used by medical doctors, is what we call as the exome sequencing, which is 2% of this whole big recipe book. So think about like this quick fix, like the ones that are most relevant for the clinician. Typically, that's what they would order, right? They order an exome, which would be the functional part of the genome. And normally, when you're trying to diagnose a disease, you're trying to understand that, you're trying to say, okay, I need to know this. I need to understand about this BRCA gene, or I need to understand about the CYP2C19 gene or something else. Typically, sometimes you can just look at those particular genes and be able to be happy with that. And then there is the third type. That's where we do, for instance, in the genome patri, right? Now, this is like going through the entire genome, but you are specifically picking out points from there. So you're looking at markers across the genome, both in the exome, but also in the intronic and the other regions of the genome. But you don't do the 90 GB of data, but you're trying to pick the right ones so that your cost is reduced, your information for the right kind of genes is there, and you're also trying to find how is it going to be relevant for the individual. So that is what would be on the sequencing side. The second thing you asked was, is there something known as the RNA sequencing? It is. It is not yet so popular. It's basically thinking that this recipe book, now you're actually translating, you're actually getting that expression done. So how do you translate from that recipe book into something that you can do the sequencing and get the expression of those particular things? The third thing I think you asked about was on the CRISPR and other.
Yeah, what is CRISPR?
And other.
Is it something therapeutic, or can it be used for intervention purpose, like gene editing and all, or just maybe in a layman's language? Yeah.
So how many of you have heard about CRISPR? A few, at least I saw 2-3 hands. So CRISPR
I think in class 12 curriculum, also in biology, there is some mention of CRISPR. Okay. But in the medical MBBS courses, I don't think they have incorporated anything on personal medicine so far. So that is also one big topic. Maybe you can ask a question. Yeah.
So CRISPR, like you have a word editor, similarly, I think CRISPR in a very, very layman terms is more like a tool that allows you to be able to change a particular sequence, right? So it has found a lot of use in diagnostics. It has found a lot of use in actual therapeutics. And it is also, we are starting to see that this is something that in the future we will start seeing a lot more of that. I think by the next 5 to 10 years, you'll see a lot more happening on the CRISPR side, because it allows you to pick very specific regions of that and be able to understand it both from a diagnostic and a therapeutic point of view. So you'll start seeing a lot more trials. If you go today to clinicaltrials.gov or other places, you will see that CRISPR and other editing technologies are finding a lot of, you start seeing a lot of that, along with things like microbiome therapeutics and many more. So there is a lot happening in this field, and I wish that, in the medical education, that these start getting incorporated, because they are the ones who are ultimately going to be using these.
So lastly, that we've been talking about public health, personalized medicine used in public health. So is it going to be cost-effective in healthcare in the long run? Do you think so? Or the initial investment itself is going to be pretty high just to make it, to actually help start an implementation of the precision medicine for public health use? So do you think it's a very cost-effective, it's going to be cost-effective in the long run? Because in comparison to the initial expenditure, I want to ask you.
I think it is extremely cost-effective, because if you think about it, today your cost of any of these genomic tests is not that expensive, right? You start at like 7,000, 8,000 to a little bit more. You're doing this once. You don't have to repeat these genetic tests, right? And that's the beauty, that for most of the genetic testing, you'd have to do it once in their lifetime, unless it is a mutation that has occurred during a cancer or something. Nobody has to repeat it, especially if you have done the whole genome sequencing. So I think let's say that if the government starts to do a sequence like maybe genotyping of a large population, you can prevent adverse effects of like giving the wrong medication. You can prevent, having potentially having some, genetic disorders. You can prevent. You can, more importantly, I think you can get better, longevity, health span for all these individuals, which basically means your productivity increases, which means your number of people who are healthy, who can contribute is also increasing. So I think even with just taking the monetary value of it, you will see that just by changing the way you are looking at nutritional values for the population or just adverse effects, that itself will pay for doing a personalized medicine exercise for the whole community.
So with this, we are coming to the end of the panel discussion. And I just like to wind up by saying that it's time for the medical students to give some exposure to personalized medicine so that the future doctors are already ready with that and they have enough knowledge to start with the changing landscape of healthcare that is going to come in next 5 to 10 years. And there should be general awareness. We should raise general awareness. ABP channel and all media should work on it, raising general awareness for personalized medicine so that people know what to expect out of it and and they go for it. That is most important. Yeah. Thank you so much. Thank you
so much.
Acharya ji.
Thank you so much. We thank moderator Dr. Suravi Sharma Kumar for moderating the session. And also we thank our speaker, Acharya. Thank you once again for sharing your expertise here with us. And to felicitate our speaker, I would request Vidya, Regional Sales Head South, to please join us on the stage. Let's give ma'am a big round of applause, everybody. Let's make this moment super special.